Colleagues, I'm delighted to be part of the Irish Nurses and Midwives Organisation Operating Department Nurses section. Again, I want to thank the organising committee for bringing this programme together. My presentation will focus on the Health Service Executive Workplace Health and Wellbeing Unit, the divisions within the unit, and the work that we do. I had the opportunity to look at the mission statement on the INMO website, and it said that the operating department nurses have a professional specialist nursing group. They're dedicated to enhancing the professionalism of operating department nurses. And certainly I have seen that throughout my years in nursing. I had the pleasure of working in the Children's Hospital in Temple Street. I spent 6 months in the operating theatre there, and thankfully worked with wonderful people like Anne O'Brien, who excelled in terms of leadership and professionalism. More recently, due to the cyber attack, I've been able to spend a few days up in City West, and Claire Dardis is leading the integrated team there in providing a super mass vaccination centre. And again, I'm a super ambassador for your service. So thanks to all of the operating department nurses and managers for the work that you do in very, very challenging circumstances. So I just want to set out the context for my presentation and to build on comments that Steve has articulated very, very clearly. We know from the World Health Organization, multiple reports, and our own government reports, and INMO reports as well, that there is an international shortage of healthcare workers, and that shortage is going to continue unless we transform the way we look after staff. We also know in Ireland that we have the 2018 Sláinte Care Report, which is a 10-year plan to transform our health and social care. Now, we're just coming out of a global pandemic, which has put an increased demand on an already challenged service. And again, your own departments are facing a significant accumulation of unmet demand due to the global pandemic. So these are really critical points to mention in the context of the work of the Workplace Health and Wellbeing Unit, and as Steve has clearly outlined what exactly needs to take place. So my presentation will focus on the functions of the unit, what we do, and the type of supports that are available to you. And again, I'm going to emphasize Steve's point again about using services and then having to go back into an already stretched system. So in terms of the divisions within the unit, as Karen said, we were set up in 2016. Dr. Linda Sisson is the national clinical lead, and Linda would have worked in Tallaght Hospital with Bruce in the past and with Steve. So Dr. Linda Sisson is our clinical lead for the Workplace Health and Wellbeing Unit. And we have 5 divisions within that unit. And you're familiar with many of them. Occupational health services throughout the country, employee assistance programs, our national health and safety function, organizational health, and rehab. So I'm going to develop those divisions just a bit more over the next few minutes and let you know what supports are in place for our healthcare workers. So in terms of occupational health services, our occupational health services are geographically spread around the country, and it's a hub and spoke model. Our model of care is clear. It's prevention, it's early intervention, it's effective rehab, it's appropriate health assessments. There's an emphasis on teaching and research, and also health and well-being. So again, emphasizing the model of care is prevention first. In terms of standards, we have a group of standards that are based on the HICWA standards for safer, better care. And just to flag those standards for you, the first one is that we are worker-centered. So the workers are at the center of the work we do. We advocate for workers, we respect workers, and it's a trusting relationship. So that soft leadership is really, really important. Our second standard is having safe and effective care for our workers. So all of our interventions must be safe and effective and must be research-based using the current best evidence. Our third standard is in the use of information. So our GDPR compliance is significant. We're relentless about that. And our OC Health services, it's a confidential service. So they're the three standards that relate to the healthcare worker who is using our occupational health services. The other standards refer to leadership and workforce planning, which again are relative to the service as well. In terms of operating departments and occupational health services, all of the pre-placement health assessment work will come through us. All the exposure-prone procedure policies will come through us, and self-referrals can be made to the OC Health service, or indeed management referrals. Last year, we launched a strategy for OC Health nursing, and that was to really modernize and advance our occupational health nursing teams within the service. And I'm happy to say that today we are advertising a key post, and that's a director of nursing within occupational health services. And I want to thank Steve Pittman and other members of the INMO who contributed to that strategy. It would be remiss of me not to mention COVID within the OC Health service, and indeed throughout this presentation. Our OC Health services were historically Monday to Friday, 9 to 5 pre-COVID. During COVID, they became it became a 7-day service. We were responsible and accountable for contact tracing amongst healthcare workers. That role is about to transition over to public health, and healthcare workers will be on the contact management program. But you can understand the activity level within our OC Health services escalated over the last 15 months. We are all acutely aware of the number of healthcare workers who contracted COVID, and it is really tough. We have a number of healthcare workers who have long COVID, and again, this is complex and very, very challenging. In terms of provision of support, our unit is appointing additional physiotherapists and occupational therapists to our occupational health services to support the rehabilitation of healthcare workers who have long COVID. So we are also setting up rapid access clinics for our healthcare workers. So that's a snapshot of the activity within our occupational health services, which is available to our healthcare workers. The second area that I'll talk about is the health and safety function. And this function is led by Nick Parkinson. And we have a legal requirement under the Health and Safety at Work Act to provide a safe working environment. It's on that basis that we have a proactive health and safety function team with 4 divisions: communications, audit, training, and policy. So the divisions pretty much speak for themselves. In terms of policies, I want to flag one key policy, and that is the policy on the prevention of stress in the workplace. And this is an evidence-based, researched policy, which guides all of us on how to manage ourselves when the demands of our job exceeds our capacity. It's very specific. It's a lengthy policy, I'll say that, but it does clarify the role of the individual, the role of the line manager, the role of HR managers, etc. So if there's one policy that we refer to, that we should all refer to as a check-in, it is certainly our HSE policy for the prevention of stress in the workplace. The stress management standards within that are evidence-based, and as I say, very clear pathways in terms of actions and roles and responsibilities. Our communications team set up a COVID helpline during COVID, and this was a very busy division within COVID. And the questions that people had were very similar to many of the points that Steve and indeed Tara had mentioned in terms of, you know, anxiety about bringing COVID home, etc. So the COVID helpline was specifically for healthcare workers. There were other helplines in place. We took the decision that a specific healthcare worker helpline was required. And again, it was received very positively by our staff. Our policy division are active in terms of the development process of policies in drafting and in consultation and in final sign-off and in indeed review. Our audit team carry out audits and inspections, and our training team provide training, and a lot of that training has gone online due to COVID. So that's an overview of the health and safety function. Suffice to say, it's a very active division, and again, it is entirely healthcare worker focused. The third division that I'll mention is the Employee Assistance Programme. So this is a free service for our healthcare workers. It's a confidential service. We have two models. If people want to receive counselling from one of our internal counsellors, they can receive it. Some people prefer to go externally, so that is available to people as well. So we have a hybrid model. Staff are available to receive 6 sessions at no cost. If somebody wants additional sessions, it's absolutely no problem. That can be accommodated. So again, it's a really important division. It's led by Morgan Lucy, who has done Trojan work in developing standards. Again, they're based on the HICWA standards for safer, better care. Just in terms of uptake of our EAP service, I can just give you a couple of figures. In 2020, last year, there were 6,175 counselling sessions. This year alone, from January to March, we have provided 2,697, which is a third of what was provided last year. We are content with people using the service. I know that doesn't sound right, but we like the figures to go up. It's a good sign when the figures go up. It means that people are, one, they're aware of the service, and secondly, that they're accessing the service. Other work that our EAP team do is they're involved in manager consultations, and they're involved in critical incident stress management. In terms of waiting times for an appointment with one of our EAP Employee Assistance Programme counsellors, it's the majority, 71% of people are waiting less than 2 weeks. We'd hope to improve that, but again, it comes down to demand and capacity. Our requests, our increase with requests can be mapped with each wave that occurred during COVID. So that is our EAP division within the Workplace Health and Wellbeing Unit. I'm just going to mention organisational health and rehab. So our organizational health division is led up by Nullig Carol, and Nullig provides support for managers on work and organizational psychology issues. It's an active unit. They're involved in policy, they're involved in stress management. And they're also involved in a major project that the unit is taking on, and that is the implementation of the World Health Organization Healthy Workplace Framework. And I'm delighted that Karen Ellis is part of this group. As I said, the World Health Organization has a framework for healthy workplaces. There are 4 pillars, and that is the physical environment, health and safety, resources, and community intervention. So this project has been endorsed by the senior management team. We have a steering group up and running, and we have subgroups starting their work. When we look at the actual content of the framework and map it against the HSE, there's certainly processes that are very clear and up to date and relevant, and there are other areas that we can build on. So the World Health Organization Healthy Workplace Framework is certainly a major project for our unit, and certainly I hope that you'll be hearing more about it in the future. Our final division is Rehab, and our rehabilitation services are led up by Deborah Moriarty. And there's an excellent policy on rehabilitation of healthcare workers, which involves case management, accommodation in the workplace, and in some cases, redeployment. This unit was very important pre-COVID. It's going to be even more important post-COVID. It's certainly a vital service, particularly when you look at long COVID, and also when you look at the aging environment of the workforce and people's capacity to keep going. Having said that, generally the philosophy is that work is good for us, and worklessness is not good. So again, the rehabilitation unit is heavily involved in terms of developing rapid access clinics for our healthcare workers, and in managing cases for accommodation and redeployment. And again, this is in the context of a very large organization with over 130,000 staff. So I have outlined the divisions within the unit, and I suppose broadly speaking, I just want to pose 2 questions out there. And again, Bruce put really important questions out to us earlier on, and I want to put 2 questions out. So with any intervention, our team will ask, what's the evidence? Is it reliable? Is it valid? Is it current? How is it collected? So for any intervention that we're asked to bring in for our workforce of 130,000 people, we will ask that, where is the evidence? And the second question is, can this service be offered to up to 130,000 people, up to the wide community within our health service? So they're the critical questions that we ask when we receive a request for a specific intervention. So that is a snapshot, and I'm conscious of the time. It's a snapshot of the activity within the Workplace Health and Wellbeing Unit. As I said, set up in 2016, led by Dr. Linda Sisson, driving a number of divisions, and the emphasis is entirely on integration of supports for all of our healthcare workers. If anybody wants to email me, I'm on sibeal.carolan@hse.ie, and we're also on Twitter.